The latest on the COVID-19 pandemic, the CDC now says most Americans have been infected at least once. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Hey, Dr. T. Wait a minute. Most Americans have been infected at least once. Do you buy that?
Absolutely.
Unhesitatingly. So let's take a look at the data. It shows that by February, about 60% of the U.S. population had been exposed, and that's nearly double the percentage seen 3 months earlier. So how did the CDC come up with those numbers?
Right, Eddie, what happens is with this particular study, they got the data from national commercial laboratories who aggregated data and then sent it to them. These are antibody tests, and interestingly, these antibodies are not the ones that that get stimulated after we're vaccinated. They're specific antibodies that we only get after we're infected, so they can figure out how many people have been infected in the U.S.
Got it. It's an accurate read. Got it.
Okay.
It's an accurate estimate.
Yeah.
We know most people in Massachusetts are vaccinated. Now we're learning, that most of us have been infected too now. Does that mean we might have more protection from COVID than we thought?
Really good news, Jessica. No one wants to get infected, but if you've gotten infected and have done well, that plus vaccination, that what we call hybrid immunity, is the most protective. We've learned that through how high our immune response gets, that robust immune response, and we know that you're less likely to get infected after you've gotten both infected and vaccinated.
Dr. T, we know that Omicron is the most contagious variant to date. I won't assign most dangerous, but I'll say contagious. Is it infecting one age group at a higher rate than another?
Right, so what the CDC study just showed is that those who are unvaccinated were more likely to get infected. And it was the younger kids, really, more than adults, who are more likely to get infected. With each progressive age group as we get older,
right,
the percentage of us being vaccinated is higher. So kids were really the most infected in this study.
Okay, and I know, Dr. Ellerin, you've told us before you're fully vaccinated, boosted, and tested positive for COVID in January. That's a lot of immunity in a short period of time. Do you think there's a chance you or someone who's been in your position may need or not need another shot?
Jessica, I think given this virus and how rapidly it's mutating and how promiscuous it is in infecting, large swaths of the world in such a short period of time, I think it's unlikely that we're not going to need any more vaccines. What the CDC and FDA and the WHO and a lot of organizations are trying to figure out is, what is that vaccine going to look like? How many sequences will it have? What's the right sequence? When is the best time to get it? There's a lot of unanswered questions. I do think there's more vaccines in our future, though.
Dr. T, live in the newsroom. Great to see you.
Take care, guys.
Take care.